DRAVET syndrome. A 5-month-old male child was brought by parents to emergency room. This infant had fever of 101 degree Fahrenheit when checked. Parents complained of right-sided jerky movement, that is hemiclonic seizure, that lasted for 3 minutes. He did not lose consciousness following this event. After seizure was under control, MRI and EEG was done for the child, which were normal. As per parents, child was developmentally normal so far. After a month, child was again brought with similar complaint, that is right-sided hemiclonic seizure. But this time there was no fever and seizure lasted for more than 30 minutes. Doctors required to use multiple seizure medication to control the seizure. Parents also said that child has been having sleep disturbances at night. Following this event, child developed multiple and frequent seizures every 1 to 2 months, lasting for 20 minutes to 2 hours till 1 year of age. After 1 year, parents started to notice that child has delay in walking and speaking. Genetic testing was done for him and was found to be having SCN1A gene mutation and diagnosed to have DRAVET syndrome. DRAVET syndrome can be very tricky to diagnose in initial stages for a pediatrician, as in early stage of the disease, it will mostly appear like febrile seizure. In this video, we will talk about DRAVET syndrome. What is DRAVET syndrome? How common is it? When to suspect DRAVET syndrome in a child? Why DRAVET syndrome occurs in some kids? How seizure evolves over time and with age in a DRAVET child? What is its mortality rate? What are the investigations to be done and how to diagnose this syndrome? How to treat a child with DRAVET syndrome? What are the advanced treatment modalities for DRAVET available currently or are expected to come in recent future? So let's get started. What is DRAVET syndrome? DRAVET syndrome is classified as a DEE or developmental and epileptic encephalopathy. DEE are a group of severe epilepsies with frequent and difficult to treat seizures that are drug resistant with significant developmental delay. DRAVET is a severe form of epilepsy or epileptic encephalopathy that begins mostly in infancy and early childhood. A DRAVET child can have multiple seizure types, and out of these different types of seizures, myoclonic seizure and tonic-clonic seizures are relatively more common. Hence, it is alternatively known by the name of SMEI, that is severe myoclonic epilepsy of infancy, or PMEI, that is polymorphic epilepsy of infancy. How common is DRAVET syndrome? It is a rare disease affecting 1 out of every 15,700 individuals. Males are 2 times more at risk to develop it. Approximately half of patients have family history of epileptic syndrome or febrile seizure. What causes DRAVET syndrome? Etiopathogenesis. Studies have shown that DRAVET is genetically determined. Around 80 to 90% of the kids with this syndrome are found to be having mutation in alpha subunit of voltage gated sodium channel gene, that is SCN1A gene. As there is defect in voltage gated sodium channel gene or channelopathy, there is imbalance in electric signal across cell membrane in brain cells. This causes seizures. Definition of DRAVET syndrome. DRAVET syndrome is a rare form of intractable epilepsy syndrome that begins in infancy and proceeds with accumulating morbidity that significantly impacts an individual throughout lifetime. Types of SCN1A gene mutation in DRAVET. Mostly the SCN1A mutation is a de novo mutation, that means it is not inherited from parents. In some cases, it can be inherited as autosomal dominant pattern. In that case, one parent may be having a variant of SCN1A gene with milder presentation of just seizure with fever without any cognition abnormality. Rarely, SCN1A gene may be present as somatic mosaicism, that is, some cells of the person have variant gene and some cell don't. Thus, the person have very mild presentation of DRAVET. Point to remember: presence of SCN1A mutation does not confirm the diagnosis. Also, absence of mutation does not exclude DRAVET syndrome diagnosis. Clinical presentation, that is, symptoms and signs, should be taken into consideration while diagnosing the same. SCN1A disorder. DRAVET syndrome is not the only manifestation of SCN1A gene mutation. This mutation can lead to a spectrum of disorders, and DRAVET syndrome lies towards the more severe end. These SCN1A disorders include milder forms like FHM, that is familial hemiplegic migraine, febrile seizure, that is FS, febrile seizure plus, that is FS plus. It also includes severe epilepsy syndromes like GEFS plus, that is generalized epilepsy with febrile seizure plus, ICE-GTC, that is intractable childhood epilepsy with generalized tonic-clonic seizure, DRAVET syndrome, that is DS, gain of function developmental and epileptic encephalopathy. It is shown in the following diagram. From less severe to more severe side, SCN1A disorders are FHM, FS, FS plus, GEFS plus, ICE plus GTC, DS, GOF, DEE. So the bottom line here is, if there are two different persons diagnosed with epilepsy syndrome and SCN1A gene mutations, one might have GEFS plus syndrome and the other might have DRAVET syndrome. Symptoms and presentation varies in both. Moreover, as DRAVET syndrome has loss of function mutation, hence it tends to be more severe. How to suspect DRAVET syndrome in a child? Clinical presentation of DRAVET syndrome. A previously developmentally normal child first presents with seizure between 2 months to 15 months of age, mostly during infancy. Average age of presentation is 5 months. Child presents with either febrile or afebrile seizure. 3/4 of the seizures are provoked by fever or warm temperature or hot bath, and 1/4 are afebrile seizures. This seizure can be focal, generalized or hemiclonic convulsions. It can be clonic or tonic-clonic. Most common type of seizures are characteristically unilateral clonic seizures, that is jerking of one side of body, and less commonly generalized tonic-clonic seizure, that is stiffening followed by jerking of whole body. Febrile seizure versus DRAVET syndrome. In early part of the disease, it is quite challenging to differentiate between DRAVET syndrome from febrile seizure. However, the primary difference is seizure in DRAVET syndrome are more frequent and prolonged. How seizure evolves over time and with age in a DRAVET child. Between 6 months to 1 year of age, child develops frequent seizure episode every 1 to 2 months, mostly febrile seizures. Later, child gets seizures even at lower temperature. Subsequently, child develops afebrile seizures. Later, seizures can be prolonged, that is more than 10 minutes and sometimes lasting for more than 30 minutes also, or up to 2 hours. They are difficult to treat and requiring multiple anticonvulsants. After 1 year of age, child may develop different seizure types. Myoclonic seizure among them are most common one. After 2 year of age, he or she develops multiple seizure types, example atypical absence seizure and sometimes complex febrile seizure also. So out of multiple seizure types, the most characteristic tetrad of seizure in DRAVET are as following: febrile clonic convulsions, myoclonic jerks, atypical absence seizure, complex focal seizures. Also, obtundation status, that is non-convulsive status epilepticus, is common after 2 years of age in a DRAVET child. Other symptoms in DRAVET syndrome. Developmental delay. When child first presents with seizure, it is developmentally normal. After 1 year of age, parents notice that there is delay in walking, speaking, etc. So to say, there is stagnation or delay in gross motor, fine motor, speech, etc. That is global developmental delay. Second, intelligence and cognition. Gradually, child develops impaired cognition and intellectual disability. Third, behavioral issue might be there in the child. Fourth, movement and balance abnormality along with impaired dexterity may be present. Fifth, orthopedic issues are often associated with DRAVET syndrome. For example, in more than 9-year children, they typically walk with crouched gait with bent knees and hip. Sixth, growth impairment and nutritional abnormality might be present. Seventh, sleep issues like troubled sleep is usually present. Fragmented sleep are nothing but seizure episode interrupting sleep pattern. 8. There may be associated autism spectrum disorders. 9. DRAVET kids have problem in processing information from senses, example sight, hearing, touch, taste, smell, etc. 10th. Dysautonomia, abnormality in autonomic nervous system that controls heart rate, blood pressure, breathing, etc. might occur in DRAVET child. 11. Tone and movement abnormality. When child is examined, there can be hypotonia. Also, there may be movement abnormality. Extrapyramidal movement disorder like rigidity, tremor, dystonia, dysarthria, etc. might be there. There may be ataxia or incoordination of movement. Also, there could be pyramidal signs like hypertonia, hypereplexia, etc. 3 phases or periods of DRAVET syndrome. First is pre-seismic period. Here the symptoms are relatively mild. This occurs during infancy and multiple febrile clonic or afebrile clonic seizures occurs which are recurring frequently every 6 to 8 weeks. Second is seismic period. Here symptoms are severe and aggressive. It starts from 2nd to 6th year of life. Here child has multiple seizure types plus severe neurocognitive and developmental deterioration may occur on daily basis and frequent progression of seizure to status may be seen. Post-seismic period. In this period, serious neurological abnormality becomes irreversible. If patient survives for more than 30 years of age, then seizure may somewhat improve. Mortality rate in a DRAVET child. When we consider survival up to 20 years of age, DRAVET child has a mortality of up to 15 to 20%, average being 17%. A significant portion of the mortality are either due to status epilepticus or due to SUDEP, that is sudden unexpected death in epilepsy, which usually happens during sleep. Differential diagnosis of DRAVET. Out of all DDs, most important to note are the following 2 conditions. First is vaccine encephalopathy. Following vaccination, child presents with psychomotor slowing and seizure. Later DRAVET is diagnosed. Hence, this kind of presentation is often confused with vaccine encephalopathy. Second is PCDH19 associated epilepsy. This is an excellent condition affecting females. It has many characteristics similar to DRAVET, hence often confused with DRAVET syndrome. Other differential diagnoses are myoclonic or atonic epilepsy, Lennox-Gastaut syndrome, GEFS plus syndrome, mitochondrial disorders, benign myoclonic epilepsy of infancy, myoclonic astatic epilepsy. How to diagnose DRAVET syndrome? Clinical signs and symptoms play a crucial role in diagnosing of DRAVET syndrome. Clinical diagnostic criteria goes like this. At least 4 of the following has to be positive. First is normal or near normal cognitive and motor development before seizure onset. Second is 2 or more seizures with or without fever before 1 year of age. Third is seizure history consisting of myoclonic, hemiclonic or generalized tonic-clonic seizure. Fourth is 2 or more seizures lasting longer than 10 minutes. Fifth is failure to respond to first-line anti-epileptic drug therapy with continued seizure after 2 years of age. Other associated symptoms and signs make the clinical diagnosis even stronger. Investigation in DRAVET. EEG. Before 1 year of age, EEG is usually normal at onset, including sleep and awake EEG. After 1 year of age, interictal EEG will start to have generalized spike wave discharges or focal and multifocal spike wave discharges. There may be diffuse slowing of EEG as well. Ictal EEG correlates with seizure type of the child. Sleep architecture is preserved. MRI. MRI brain is usually normal. On rare occasions, there can be mild cerebral or cerebellar atrophy or hippocampal sclerosis in later life. Genetic epilepsy panel. When to do genetic testing? Genetic testing via epilepsy panel is important in initial stage of the disease. EEG and MRI are normal and child is developmentally normal. Genetic testing should be considered in the following condition. 2 or more prolonged seizure by 1 year of age, 1 prolonged seizure and any hemiclonic seizure by 1 year of age, 2 seizures of any length that seems to affect alternating side of body, history of seizure prior to 18 months of age and later emergence of myoclonic and or absent seizures. Genetic test via epilepsy panel includes SCN1A gene and other genes related to epilepsy. A severe SCN1A gene defect is strongly supportive but not diagnostic of DRAVET syndrome, as it can be positive in other SCN1A gene disorder like GEFS plus as discussed previously. Functional brain imaging. It may be normal or may show focal hypoperfusion and hypometabolism even when MRI is normal. Metabolic abnormalities are absent and tissue biopsy are normal in DRAVET child. Treatment of DRAVET. Anti-epileptic drugs may reduce seizure frequency and severity but do not control them completely. Preferred anti-epileptics are listed below. First-line anti-epileptics are clobazam, valproate, benzodiazepine, phenobarbital. These can be given. Second-line treatment is stiripentol, topiramate. Stiripentol is licensed in 2009 along with other anticonvulsant for refractory GTCS. Ketogenic diet more in fat and less in carbohydrate, is beneficial in 50% of the cases if started yearly. Third line treatment, clonazepam, levetiracetam, zonisamide, ethosuximide, vagal stimulation, etc. Drugs to be avoided in DRAVET syndrome. These are as following: carbamazepine, oxcarbamazepine, phenytoin, fosphenytoin, lamotrigine, vigabatrin, rufinamide. These make seizure worse. Important point to remember is avoid sodium channel blocker in DRAVET syndrome as these are contraindicated in DRAVET. Newer medications. US FDA has approved cannabidiol and fenfluramine. Epidiolex, otherwise known as cannabidiol or CBD, is approved for DRAVET syndrome patient of more than 1 year of age. Fenfluramine is another medication that can be used in more than 2 years of age. Further studies are going on to find out other genes apart from SCN1A gene. Also, gene-based therapy are under trial for specific treatment in specific cases. Along with all this supportive treatment like physical, occupational and speech therapy is quite important. Can DRAVET be cured? As of June 2024, 2 gene-based therapy are currently under human trial to cure underlying cause of the DRAVET. First is an antisense oligonucleotide ASO developed by Stoke called STK001. Second is an AAV delivered gene regulation therapy called ETX101. Therapeutics is approved. Human trial is going to start for the same. Summary. High index of suspicion if child is getting frequent prolonged seizure. First. Second, in first year of life, in a DRAVET child, EEG and MRI are normal. Third, further diagnosis is nearly certain if intractable myoclonic jerks and mental deterioration occurs between 1 to 2 years of life. Fourth, main goal of treatment is to stop seizure and reduce seizure frequently and to prevent SUDEP. Thank you for watching today's video. If you really liked it, then hit the like button. Share this video with your friends and do subscribe to Pediatric Simplified. Disclaimer, this video is for educational purpose only. For medical advice, kindly consult your physician.